Question 1. A mother who has been exclusively breastfeeding her baby for 6 months asks the nurse about additional nutrition for the infant. What information should the nurse provide? C. Gradually add cereal and cured meat. The American Academy of Pediatrics recommends and NBSB, breastfeeding and NBSB, or formula as the sole source of nutrition for about 6 months. And NBSB. After that, it may be time to add more nutrients, protein, iron, and zinc. These are found in iron-fortified cereal and cured meats. Single-ingredient foods without salt or sugar should be introduced one at a time, 3 to 5 days apart, to assess if the baby has an adverse reaction, such as diarrhea, vomiting, or rash. Breastfeeding or formula should be continued until the baby is 1 year old. Fruits, puddings, and desserts are not appropriate for infants. Finger foods do not supply necessary nutrients. Question 2. At what age can the pediatric nurse accurately measure a radial pulse in a child? A. 2 years. Under the age of 2, an apical pulse is most accurate and easy to locate. A radial pulse can be difficult to palpate and count in an infant and young child. Typically, apical pulse rate is taken for a full minute to ensure accuracy. This is particularly important in infants and children due to the possible presence of sinus arrhythmia. Question 3. The mother of a hospitalized 3-year-old tells the nurse that she must leave for a short while to pick up the child's sibling from school. The child asks the nurse when the mother will return. What is the nurse's best response? A. You will see your mom after you watch your favorite show. Preschoolers, ages 3 to 4, do not have a clear concept of time. They develop the concept by meaningful experiences, such as birthdays, and with their own schedule, such as meals or bedtime. They feel secure when they can understand and follow a schedule. They do well with before and after explanations. Question 4. The nurse is instructing parents on how to care for their 3-year-old child with a new diagnosis of Wilms tumor. One of the parents asks why they shouldn't press on the child's abdomen or be careful when bathing the child. What is the nurse's best response? C. It's important to keep the tumor intact. Wilms tumor, also called nephroblastoma, is the most common form of kidney cancer in children. The tumor expands the renal parenchyma, and the capsule of the kidney becomes stretched over the surface of the tumor. Parents and caregivers should be instructed to never and NBSB, palpate and NBSB, the abdomen of a child with and NBSB, Wilms and NBSB, tumor, as this increases the risk of rupturing the encapsulated and NBSB, tumor, which could cause cancer cells to spread to other areas of the body. Wilms tumor is usually not painful. If there is pain, it is from the rapid growth of the tumor. High blood pressure is triggered when the tumor blocks the blood supply to the kidney. Constipation is a possible complication, not diarrhea. Question 5. The nurse is at home with their 10-year-old son when the child falls off his bike and his front tooth is avulsed, knocked out. The nurse is able to quickly retrieve the tooth. What is the nurse's best action before going to the emergency department? A. Place the tooth in milk for transport to the ED. An avulsed tooth is totally dislodged from its socket. It is medical dental emergency that requires prompt treatment to minimize hypoxia and necrosis of the pulp of the tooth. Reinsertion should be done within a few hours. Do not touch or handle the root of the tooth. Rinse the tooth with saline and pack the socket with sterile gauze. The preferred storage solution is milk, with saline or saliva if milk is not available. Holding the tooth in the cheek helps keep it moist, but there is a risk of the child swallowing it, so this is not an ideal solution. Question 6. Which of the following pediatric clients is at the greatest risk to develop pediatric acute respiratory distress syndrome, PARDS? A. A child with a drowning experience. Pediatric acute respiratory distress syndrome, PARDS, occurs when fluid fills the lungs due to an infection or injury. Acute respiratory distress syndrome, ARDS, is a major complication caused by aspiration of water upon and NBSB, drowning, in which permeabilities of the and NBSB, lung and NBSB, alveolar and capillary walls increase, resulting in exudates in the alveoli that cause hypoxia unresponsive to oxygen therapy due to and NBSB, lung and NBSB, injury. While pneumonia can lead to ARDS, a temperature of 103.4 F does not provide enough information to determine if pneumonia is present. Congenital heart defects must be monitored, but this is not the condition most likely to cause ARDS. A leg fracture is a risk for pulmonary embolism, rarely associated with ARDS. Question 7. The nurse is reviewing laboratory results for a child with tetralogy of Fallot. Which value can the nurse expect to be elevated? C. Hemoglobin and hematocrit. Typical lab findings for tetralogy of Fallot include diminished oxygen saturation, hematocrit between 65% to 70%, normal is about 37 to 47%, and low platelet count and coagulation factors. Low O2 levels stimulate erythropoietin production by the kidneys and lead to a secondary polycythemia. Secondary polycythemia is characterized by higher than expected hemoglobin and hematocrit levels. The WBC count, BUN, and creatinine aren't directly related to this condition. Question 8. A pregnant client tells the nurse that her 5-year-old son asked, "How did the baby get in your tummy?" The mother asks the nurse how to answer the child's question. What is the nurse's most appropriate response? B. When your child asks, give a simple and honest answer. Sex education should be honest and age-appropriate. An appropriate response for a 5-year-old might be, a mother and a father make a baby by holding each other in a special way. The parents can also correct misinformation and tell the child that the baby is growing in a special place called the uterus. Question 9. The pediatric nurse is assessing a 5-year-old child for lead poisoning. Which finding will indicate the need for further follow-up? B. Visual motor problems. Lead poisoning occurs when lead builds up in the body, often over months or years. Even small amounts of lead can cause serious health problems. Children younger than 6 years of age are especially vulnerable to lead poisoning, which can severely affect mental and physical development. Neurocognitive indications include developmental delays, lowered intelligence quotient, IQ, reading skill deficits, visual spatial problems, visual motor problems, learning disabilities, and lower academic success. Signs and symptoms of lead poisoning in children also include hearing loss, irritability, loss of appetite, sluggishness and fatigue, abdominal pain, vomiting, constipation, and seizures. The other 3 answer choices are not associated with lead poisoning. Question 10. The nurse is admitting a child scheduled for a hernia repair. When obtaining the child's medical history, the nurse lists the following allergies. Which of these is most important for the nurse to document in the medical record and flag in the system? B. Balloons. Although all allergies should be documented and shared, the child's allergy to balloons indicates a latex allergy. Latex is used throughout a hospital: gloves, catheters, bandages, tape, electrode pads, and stethoscope tubing. Besides noting the egg allergy in the medical record, the child should also avoid foods that are linked with latex allergy: peaches, nectarines, apples, kiwi, figs, celery, carrots, tomatoes, papaya,